asking purposeful rounding questions. A lot of you have probably seen some of this content already, and that's great. It's a great foundation to have, but we will be going through a little bit of that foundation for anybody who hasn't already read through our guide on the similar topic. Before we get into that though, just a couple of housekeeping items. All the attendee lines are on mute, but we welcome any questions that you have. So if you do have questions throughout the webinar, please go ahead and type those into the questions box on the right-hand panel side. Also, slides are available in the handout section, also in that right-hand side. You can download those. That includes the slides. It also includes the guide that we put together on putting together effective rounding templates, as well as a little cheat sheet flyer with a backside that has a worksheet that we will go over at the very end of this webinar. We will also be sending out links to these, as well as a recording of this presentation after the webinar, probably tomorrow after we upload the webinar. So let's dive right in. This is our agenda for today. There's really only a couple of big topics that we want to cover, but there's a lot of information within those. So the first one is going to be the rounding template foundation. This information is going to look really familiar to you if you've downloaded the guide, but we really wanted to give that foundation because it is really important to know this information as you're creating templates, as well as the questions that you're asking. We're then going to get into some example questions, both kind of some good and the bad ones, and how we can tweak your questions to make them more effective and really be getting the most out of your rounding questions and templates. So then let's talk about who's on the line with you. We have 4 people on the line with you today. My name is Katie Anthony. I'm the marketing coordinator here at MyRounding, as well as your host for today. And I have 3 very talented rounding individuals with me on the phone, Michael, Kathy, and Bonnie. Do you want to introduce yourselves, Michael?
Sure. Thanks, Katie. My name is Michael Niederhauser. I'm the Vice President of Customer Experience here at MyRounding. And over the last several years, I've had a unique opportunity to visit many hospitals throughout the state, almost 100, and have seen all manner of good, bad, and ugly rounding questions. And so I'm passionate and excited about taking a couple minutes today to spend with you to talk about some really effective rounding questions.
My name is Cassie Von Minden, and I am a customer experience lead here at MyRounding. And I have spent the past 5 years or so working with healthcare systems to help drive their market share by improving the patient experience.
Thank you, Cassie. My name is Bonnie Eiserman. I am a senior for the Customer Experience Account Management team, and I work with about 300 facilities, which include hospitals, hospital systems, medical clinics, ambulatory clinics, and even physician groups. So I'm really excited to be on the call today.
Great. Well, thank you all so much for joining us. You have a lot of great information to share, so I can't wait to hear about it. So with that, let's find out who's on the line with us. So you should have a poll that just popped up on your screen. And we really just want to find out who you are within your organization so we can customize our webinar a little bit to you. So just select which role you really identify with the most within your organization. There's a few different options there. It looks like we have a lot of department managers on, which is great. We actually have a little bit of attendance from across the board, but it's jumping around still, so I'll give you a few more seconds. All right, get those last few votes in about who you are. All right, looks like we have most people voted. Thank you so much. So I'm sharing the results with you right now. So we have a great spread. We have about almost 40% department managers, which is a great person to have here on the phone. We also do have some executive leadership, which is very important that you all have the buy-in as well. And then we have a great spread across the project leaders, the care team members, and the non-staff for those other roles. So thank you all for joining us today. We're excited to have you on here. And with that, let's go ahead and dive into the content. So Michael, would you like to dive in and give us a little bit of a foundation?
Absolutely. So why are we even bothering with this stuff? We need to take a step back and realize we're actually setting a foundation for purposeful rounding. It is very time consuming to round, And if it's not done in a calculated way, we're not getting what we want out of it, I would argue it's a waste of time of a very expensive resource, and we're possibly even missing the mark on what it is we've set out to do in the first place. So we're going to use this concept and move forward and talk primarily around patient rounding when it comes to setting some effective questions, but just realize that the concepts that we're talking about today can apply to any other types of rounds as well, including staff rounds. So again, we'll focus on patients as we move forward, but there is broad applicability. So let's now take a quick look at what happens when we go from either a program without rounding or no rounding or even non-purposeful rounding to a set of excellent purposeful rounding questions. When you take a look at this chart here, you might notice a good deal of variability, some peaks and valleys. At a certain point in this chart, you're actually going to see the peaks and valleys stop. In this organization, that's when they implemented purposeful rounding following a methodology that's similar to what we're going through today. Now, you might say, well, geez, those peaks have gone away. Well, indeed they have, and so have the valleys. What we see happen time and time again through purposeful rounding initiatives is a reduction of variance in scores and outcomes. This then becomes so much easier to manage over the long term because we're not managing by exception. We actually have a baseline that we can work from. The other thing that I think is really important for you to note here is we're not talking about overnight results. If you just think about the time it takes for survey results to come back, we have, if you're lucky, a month turnaround in those results, but oftentimes up to 90 days. And so this is a journey that takes time, and being committed to it over a long haul is important to think about, so that as you take this information away today, you go to your institutions and make some changes, realize that it's a journey, it's not a one-stop shop overnight fix.
Those are great points, Michael. And I do want to point out that the last data point on there, it looks really low, but the actual returned result at that point was 8 instead of between 60 and 80. So that just had a very low response rate at that point. So that's why the scores are not as high right there. It's not that they absolutely dive-bombed right there.
Good point.
All right.
So how many questions? And the important thing here is how many questions do we want to ask? We're going to go a little bit further into this around observational questions, but really, how many questions are we asking? We have a guideline of no more than 5. Well, why in the world no more than 5? Well, first of all, it allows you to have a quick and efficient round. We have limited number of questions. We can get to the point faster. This makes it easier for our staff to conduct. It makes it easier for the patients, less of a burden, and it allows time to have a conversation. So all too often we think we have a round, we're going to go through these 5 questions. I would argue that the most important part of a round is a connection itself. And if we're talking about patients as we are, finding out if that patient has a certain love or appreciation of something and laughing about that is going to be what makes a good experience a great experience. So I think it's critical we allow time to have that conversation. By keeping our directed questions to 5, it can really help that. Now, the other thing I did want to mention as well, when we have a small number of questions, we're really reducing the number of variables that we're trying to adjust, and this creates actionable data. So if we're really looking at 5 individual areas, and I start to tinker with one of those, we can start to see if it has outcomes. If I have 20 variables that we're working with, it's oftentimes not clear what's going to make it change and what has made an impact, either positive or negative. So a lot of great reasons to keep it simple. So how am I going to determine which 5 questions to ask? Well, we've come up with a little methodology that we're thinking about in terms of 2-2-1. We want to focus on what's important to the roundee or the patient in this example, and we suggest 2 questions there. What's important to the department? This might be very specific to HCAHPS. It might be something more general about a new process or operational component. And finally, keeping in mind our organization level initiatives as well. So each one of these will have specific goals, which will then turn into specific question types, which will oftentimes need to be reiterated and refined over time. Now, it's important to note, Katie, that these questions and these rounding templates are not static. In fact, as we make positive improvements and we see outcomes, we're going to come back and adjust these questions. So we still want to maintain the 5 as the focus, but those 5 will most certainly change over time as we're improving.
Great information, Michael.
Take a quick look here. So one of the ways when we have the 2-2-1 in mind, we want to balance individual questions through this filter. Is it observable? Is the question or is the individual qualified to answer? Are we asking that individual to tattle? Do they know the answer to the question? And finally, does it meet our goal?
Great. So based on this filter, we're going to ask another poll question. And that's, which of these 5 filters provides the most opportunity for you and your organization to improve your template?
So I'll go back through those while you're thinking about this a little bit. Is it observable? If we're asking someone a question that we can observe, I would argue, let's not ask it at all. Is this question too technical? Is the patient qualified to answer a question about their labs or about some radiology report, etc.? Are we asking the patient to tattle on a team member? Are they going to perceive that as getting someone in trouble? Will the patient even know an answer? And finally, does it meet a goal? Is it interesting to know, or truly is it meeting one of our goals? Katie, how are the results coming in?
Yeah, we're getting some great results here. We're still waiting on a few people to poll in here, so go ahead and look at those and mark those. I think you can actually select multiple if you'd like. But it looks like a lot of the people are looking mainly around observable, tattle, and also goal.
Interesting.
Yeah.
Really interesting.
So those are definitely some really big questions there. But, oh, we jumped up a lot in our poll, so that's great. So keep on voting. Michael, which one do you think is the one that you see the most often as being a barrier?
You know, honestly, I think it comes back to goal. I think there's a lot of things that we would like to know about our patients and our team, but aren't directly related to an overarching initiative. And, you know, I always come back and say, you know, what did I learn? What can I do with this information? And if what I learned was interesting, but I can't do anything with it, it's a waste of our time. So I always come back to the goal. That said, I think we probably have the most opportunity for quick wins in observable and tattle, because those are things that we can easily take a look at, change a question, perhaps remove it, and unburden the patient themselves.
Yeah, and it looks like the people on the phone are right in line with you, Michael. Goal is our #1 response, with 60% thinking that goal is going to be one of their really big quick wins.
Good.
Awesome. So I'm going to get rid of these results real quick, and let's move on to going through some sample questions.
Great. Well, I think one way that would be wonderful to do this is if we hand it off to a couple team members and they talk through some examples that we've seen out in hospitals, hospital systems, and the marketplace at large. Kathy?
Yeah, absolutely. Well, I think that was a great overview of how to set a template up and the importance of having the short, concise template. So now we're going to hit through each of those filters to discuss, you know, some good, bad, okay answers to those, so we can make sure that you are setting up your templates for success. For our first one, observable, when we go in to do these rounds, we really only have 10 minutes with the patient. When we're in the room with them, do we really want to be asking them questions that we can quickly observe when we walk in the room? I mean, I think the answer is no. We would much rather spend those 10 minutes asking them, talking to them about their needs, what's most important to them, you know, and really getting their feedback about their care, our organization, you know, the reason why we're doing the rounds. So as you can see on the board, there's some examples that we've seen across the industry that have been used a lot to ask the patient. So the whiteboard, has your room been kept clean? Another example, I know a common trend right now is the hourly rounding, and you know, asking the patient, has the nurse came in to do the hourly rounding?
Very good, Cassie. And what are some examples that clients could utilize in order to kind of change these questions around?
Yeah, so going back to that hourly rounding example, instead of actually asking the patient, you know, has a nurse been in to check on you every hour, instead of that, coach the nurse and coach the staff to put a tally mark in each time they've been into the patient room on the whiteboard. that way, we can turn it to the observable. And when the leader walks in the room, they can quickly see, wow, they already have 5 checks for the day. Nurse Cassie has been in the room. Great. Move on to the next question to find out what is important to the patient.
That's very good. And I was actually recently working with a client who saw this happening, and they made a change to their questions so that they would just be observation questions. The benefit, of course, for the round itself was that they simplified the template. And of course, the impact was it saved time for the nurse leader in the room, not asking those questions. And it really met the patient's needs, where they were having that meaningful conversation, building that meaningful conversation, and not really asking the patient to answer these questions for them.
Nice. This also speaks a little bit to, and has a little bit of a hint in your example, Cassie, to tattle, which will come on later. We're asking if someone's come in every hour, right?
Mm-hmm.
So more to come there. So that was observable. Let's now take a little bit of a shift down in the funnel and start to think about, really, is the question too technical for a patient? Really, are we asking them to answer something that they shouldn't really know, we shouldn't expect them to know? What are your thoughts on that?
Yeah, anytime you go to the hospital, there's a million things going on through your mind. You're at a very vulnerable state with, what's going on with my body, with my family. Is that person down the street really coming to take care of my dog? There's a lot of things you're thinking of. So you don't want to be thinking of other things that, people may be bringing on to you about, different things. So for example, that one we have here is, did we maintain a sterile environment while inserting your catheter? First of all, you're getting a catheter inserted. You're probably very concerned about what's going to happen. How long is this going to be in me? You're not paying attention to what is going on. Did the nurse wash their hands? What's happening with the catheter? So, Bonnie, I think if someone asked me this question, I wouldn't feel very thrilled about, well, why are they asking me this question? What are your thoughts on this?
Yeah, I think that when we're looking at this question, it'd be better that we pose the question in a much different way. In fact, asking the patient, for example, do you have any questions about your catheter? What this does is it opens the question up to the patient to where you can really get to their main concerns. What's most important to them when it comes to this catheter? They're not paying attention to whether or not it was sterilized. Heck, they probably don't even know what the procedure is to make sure that that would be a sterilized environment for them. But they might have questions pertaining to their knowledge of what happens when, they're in the hospital. So this would be a much better way to ask the question.
It makes me think about the situation where if I'm in a restaurant, someone brings me my food, the waiter says, do you have any hair in your food? That completely changes my experience. My expectation up front is that everything is going to happen in a sterile environment. My expectation in a restaurant is there's not going to be any hair in my food. Oh my goodness, you're changing my expectations that, some of the times there is hair in food. Some of the times we're not in a sterile environment. And believe it or not, this is a real question that we've seen out in the marketplace.
That really provides a lot of stress to that patient. If you're bringing up these things that they might have not even been thinking about beforehand.
Yeah, absolutely. And I think there's a lot of things that can be done on the back end to make sure that this is a sterile environment, whether it's different audits, checklists, safety procedures to make sure that this is being done. This isn't something that we need to share with the patient. It should just be, what we do in our culture to make sure that this infection is not going to take place.
Awesome. Great points there. This is one of my favorites, and again, along with the crew here on the call, are we putting the patient in a situation where they need to tattle on someone?
Yeah, I don't think anyone ever wants to be a tattletale, Michael, especially when you are in the hospital and you don't want to tell on that nurse who's already having a bad day and they overhear that you said a negative comment about them and now they don't want to come and check on you every hour because they're just not having a great day and that set them over. So when we're asking questions to the patients, it's very important that first of all, we make sure that it's a very positive question, that we're trying to get a positive response out of them. So asking them, to tattle on someone, did someone do something wrong? Did someone not do this? It's gonna, like the example we just talked about before, put them in the wrong mindset where they're not trying to be. So the example on the screen right now is just one of our goals is to not use technical jargon. Has Nurse Cassie talk to you in plain language? I think a few different things with this, and Bonnie definitely chime in as, maybe the patient was a nurse 5 years ago. So they know the technical jargon, and for them, that is plain language. Rather, the patient in the room next door to them, who was a kindergarten teacher, has no idea even, what the difference between Advil and ibuprofen is. So I think there's a lot of opportunity here to make sure that we're asking the patient, what they know, what they have questions on, instead of, asking them to tattle on who's not doing their job correctly.
Mm-hmm.
That's a very good point, Cassie. And so we've gotten a better way, more effective ways to ask these questions, really. And so one of them is, making sure that the patient knows that the goal is that we're communicating with the patient. And so we could ask, is there anything that you didn't understand or you'd like me to go over with you again? This is a much more effective question. And again, like patients already, as you said, are in a vulnerable situation while they're in the hospital or while they're in their stay. And they could possibly feel like if they're tattling, that it is going to affect their care. So it is really important that we're just kind of restructuring these questions to really maintain that meaningful conversation and also not put the patient in a position to have to tattle.
So what we're trying to do with each one of these as we move down the funnel is remove barriers and remove anxiety from the patient. And this next one, no, is the patient going to feel foolish if they don't know the answer? Depending on where they're at in their care and their stay, they may or may not have received certain points of information, and being conscious around what information is delivered when can really help us to understand if we're putting a patient in a situation where they're going to feel foolish, which obviously we don't want to do. Why don't we talk about a really, really common example here, and that's around medications.
Yeah, so absolutely, when the patients are in the hospital, again, they're not in the right place. They're not comfortable. Likely they're on several different medications that, who knows if it's making them drowsy, making them, just whatever it may be. They may not recall exactly what the name of the medication was. To this day, I probably can't name any of the medications I've taken in the past 2 years because, they're very long technical names that have 30 plus letters in them. So it's hard enough for me to remember that. But why we're asking this question is really not to quiz the patient, seeing, do they know or do they not know, make it a game. No, we want to find out, does the patient know why they're taking the medication? So instead of asking what the names are, because maybe the patient knows the name, but they don't know what it does, it's important to focus on what they know and what they don't know and what we need to go back and teach them.
Cassie, that reminds me of a very personal story. I had my son about a year ago and I went into the hospital for the stay. And we had already gone through the process to begin delivery. And midway through, they began to ask me questions about labs that had been taken when I was 36 weeks pregnant. And I didn't know the answer to those questions, but I began to realize that they didn't know the answers either. And because of that, they misstepped, and I had to actually be on an IV drip for antibiotics after my water was already broken. And that created not just a sense of foolishness in me, and it really didn't for me. It actually created a lot of anxiety and frustration and fear for the safety of my child, because had we not found that out, had they not gotten a hold of my doctor, it might not have turned out so well for my son, who is a healthy 1-year-old now. But, looking back, I asked myself, what could they have done different to maybe set my mind at ease? And I think that they could have asked questions. Ultimately, they could have called my doctor without asking me, but they could have also asked me, were there any things that happened during your pregnancy? Are there any questions that you have, any sort of things that kind of stand out to you that you want the answer to as we kind of go through this process with you? And I would have felt much more at ease. I mean, when you go into the hospital, you're really relinquishing everything to who you consider to be experts. And so you don't want to be put in that position.
Bonnie, that's a great point. And really asking these more open-ended questions around some of these topics is a great opportunity for you to find out what they know and what they don't know. And, maybe that's an opportunity for you to either educate them further or find out about something, from the team, from the doctor, from the nursing staff.
Yeah, and I think speaking to the patients, asking them these open-ended questions, really focusing on them and their care, that's going to allow that patient to open up and maybe even tell you more than just that question you're asking. Maybe we ask them question, tell me about your medications. They say, hey, I know this, but hey, I really want to talk to you about this. I'm really concerned that, nurse, XYZ said this to me, and I don't think that that's part of my care. Can you please confirm this? So really allowing it so the patient knows that they can come to you, they can talk to you about anything within their care, and it's, that comfort zone is really going to make a big headway within what you're trying to do with your goals.
Great. Well, we certainly don't want to make people feel foolish. And as I look back up, the funnel, title, qualified, observable, everything truly does come back to the goal. And are we really aligned either with what the patient's needs are, with the department, or even our organization at large? Coming back here and really thinking about that last question, we might have a very specific concern and driver around medication side effects. We know this at the unit level. I would argue then we should change that last question just slightly. Tell me about any side effects of the medication you're on. So that might be a good way to approach our overall goal philosophy. What other thoughts do you have, Cassie, Bonnie, around this particular area?
Well, what we've really seen in the market is that when individuals or when hospital systems are beginning to implement rounding and purposeful rounding, they really see that there's this general goal of improving their HCAHPS around the board. And so they begin to put all of the questions for all of the domains within perhaps one round itself. And what we've seen to be a best practice or a better way of doing this is really honing in on one of those domains that really might make all the difference. In fact, care transition, which is a very recent addition to the domains, is one that actually we've seen cascades in effect to all of the domains across the board. And so maybe honing in on one specific goal, hardwiring some excellence within that goal, and then noticing that you're seeing improvement there. Once that is hardwired, you can move on to another domain and another goal. For care transitions, a great question would be, tell me about your care when you go home. What is that going to look like? And then really centering the round on that itself. Cassie, what are your thoughts on that?
Yeah, I completely agree. And, having these questions on the rounds is going to really allow us to find out, what's most important to the patient about this dimension. And with that, it's going to allow our staff to focus on one very specific thing instead of having, all the HCAHPS dimensions. They see, oh my gosh, we're low in 3 of them. Where do we focus? We don't have the time to worry about that. So I think allowing for everyone at the organization to know this is what we're focusing on for this quarter. We'll see what happens. Maybe we'll change next quarter is definitely one way that you can see those scores increase. So I think, focusing on that, and like Bonnie and Michael said even earlier, that you can change these questions. So maybe we have the care transition question and we decide, this isn't the best question to ask the patient. Maybe we should change it to something else and see what kind of results those get the next quarter. So it's customizable, so that's great. It allows you to pick and choose which goal, but having that one focus to really make that your culture change is how you're going to hit those HCAHPS goals.
Yeah, that's huge. I mean, picking those small wins or something that's easily obtainable and then moving on to something else, that's how you're going to achieve results.
Yeah.
So thank you all for providing that great information on all of these. I'm going to launch one last poll here in the last couple of minutes. And that is, based on everything that we've already seen through this filter, the 5 different tiers, how would you improve this question? Does anything in your environment prevent a fall risk? So asking a patient that question. So which of one or more of the following categories do you think that would get stuck in the filter at? So it looks like we're having a couple of votes come in already, but I encourage everybody else to jump in. We just want to make sure that you have a really good understanding of how these questions can be updated and how they're going to get stuck in the filter to really make sure that you can improve them. And also, right after this, we are going to show you kind of a best practice for how to create a question in your template. So we're going to dive into that. So don't check out on us just yet. We have just a couple more things to go over. I know that we have only a few minutes left. All right, great. So it looks like most people have voted, so I'm closing it. And we have about 67% of people saying it's observable, 28% of people saying it's qualified, 22% of people saying paddle, 22% saying no, and 17% saying goal. Do you guys want to weigh in on what you think are the filters here?
Well, I mean, I think every single one of those is right. You know, the interesting one is goal, depending on what we're trying to do. Most likely this is not a top tier item, although it's part of our operational excellence initiatives, most likely. So I think I love it. I mean, we can definitely change this around. I can do an environmental scan very easily and see that. I could ask the patient, hey, tell me about those funny yellow socks you have. You know, those are pretty high fashion. We can start to understand if they understand that they are a high fall risk and so on. So lots of different ways we can go about that.
And I think even using the fall risk, patients may not know what all is included in a fall risk. You know, maybe they think, well, there's no cords on the ground, so I'm good. But they don't know, like you said, about the socks, that there is that, you know, stability underneath, or the different types of mats that are used. So those are all great examples.
Great. So as I just mentioned, we're just going to go over real quick kind of best practice that we do here at MyRounding. And this is going to be a worksheet that's available in the right-hand side in the handouts panel.
This just summarizes essentially everything we've talked about. Start with your goal. You're going to, based on that goal, come up with a question and then run it through the funnel. And if it checks all the boxes, take a step back and try and think about what type of information am I trying to collect? Is this an open-ended question? I want to collect some qualitative information. Or is this more of a quantitative, a yes, no, or maybe sometimes, always, never sort of a situation? That would be the qualitative, or perhaps both. And that will help you then to take one final look back at your question and really fine tune it to come up with that effective round question. Rinse and repeat for the 4 others, and you have yourselves a very purposeful round that you can continue to use this sheet and this process to keep up to date and relevant to meet your ongoing and improving needs.
Great. Well, thank you all for joining us, both our panel here as well as everybody on the line. This has been a great webinar, I think, with a lot of good information that is really useful. Just real quick, if you have questions, please do put them into the questions box on the right-hand side. I have already gotten a few questions, which is great, but keep typing those in there and let us know what you're thinking. If you have any additional questions after we end this webinar, email us at the URL that's on the screen. So it's info@myrounding.com. Most of us actually get those emails, and we'll be able to make sure that we get your question answered and answered well. You'll also be receiving a link tomorrow to the recording, as well as any of these files that you might want. They are all available except for the recording in the handouts panel on the right-hand side. So I do encourage you to download those and use those as references. And also, we do have a lot of resources on our website at myrounding.com/resources. And we have a lot of ebooks as well as some webinars that we've done in the past. So please utilize us for all of those rounding best practices and other topics there. We also try to do an ebook or some sort of content every month. So check back to our website to make sure that you're staying up to date. I do want to point out that our next couple are really exciting here. In the next couple of weeks, we're going to be implementing a refreshed version of our rounding implementation guide. And then also in August, we're going to be talking about hospital-associated infections, which is a huge concern to probably every hospital or health system out there. So make sure that you're checking back for those. And let's dive into the questions. And again, if you have more questions, please answer or ask them into the questions box. So the first question is, does MyRounding provide best practice templates that we could use? So real quick before I let you guys dive in, this is going to be something that the rounding implementation kit will have a lot of that will be releasing here in the next couple months, or weeks, excuse me. But go ahead and if any of you want to speak to our best practice template.
Yeah, we do have several different best practice templates. Obviously, they may be different for inpatient ED, some outpatient settings, but we're happy to work with you, and your account manager would be happy to set up some time with you to discuss those templates, as we have the best practice, but it may not be exactly what your goals are. So we want to have the discussion on what's your goal, what's your focus, and we'd be happy to assist you with creating these templates.
Great. All right. Should staff rounds, or I'm going to open it up to other types of rounds, should they only be 5 questions as well?
I think that should be a target. In reality, I think with staff rounds especially, we have some other organizational goals that we're trying to gauge, but you know, the Studer Group, to use an example, they obviously have great industry knowledge and literally wrote the book on rounding with a focus on staff rounding. They have 5 excellent questions that really get to the heart of engaging staff members. So I would honestly aim for 5, but you know, if you go 6 or 7, it's not going to be the end of the world. Just realize it takes more time and you're introducing more variables. So there's pros and cons.
Great information. You asked a lot of open-ended questions today as the suggested questions. Should they all be open-ended?
You know, I personally think that a mix is relevant, but you can always ask an open-ended question and collect the data in a quantitative way. And so, you know, if I'm, just to use a silly example, if I'm asking a staff member, you know, maybe how satisfied they are with, you know, the coffee selection, I might ask them in an open-ended way, tell me about, you know, our coffee selection. And I might have likes, neutral, dislikes as my option. So I'm still engaging in that open conversation, but I'm able to collect it in a quantitative way, and then we can run reports on it. So generally speaking, I will always coach and suggest to start out open-ended. You can then analyze that data to figure out what your key themes are. Still ask the open-ended question, but collect the data in more of a quantitative sort of way. So the short answer is, yeah, I mean, I think the majority of the time asking open-ended questions when you're having a discussion with someone will give you more than you anticipated.
Great. All right, we do have a question that, can we receive the question template worksheet to develop our own question? And yes, that is available in the handout section on the right-hand side. It's called poster-worksheet. Go ahead and download that. And if you need anything else, or if you're referring to something else, go ahead and just email us at info@myrounding.com and we'll make sure to get you whatever you're looking for. All right, next question, and these have been great questions, so keep them coming. Any specific advice regarding rounding on patients in a behavioral health setting?
Well, I would encourage you to take a step back and first talk about your goals and really use that as your drivers. You know, I think making sure that your staff is set up for success in those environments and really focusing on families when applicable, in addition to the patients, is really a great practice that we've seen. But depending on your focus in that behavioral practice, it really, we've seen a variety of different things, and it really comes back to your goals, what it is that you want to achieve, and formulating your rounds around that. And what you might find is some of those goals, in fact, all of those goals to start out with, might be observable. And that can be a way to approach it. So keep in mind that although we're focusing on rounding person to person, a lot of the times, a lot of what we're talking about can be handled through other means. And we talked about the catheter. I mean, that's a CAUTI or a CLABSI audit earlier as well. So coming up with audits can supplement rounds and really help to simplify rounds as well.
Great, thanks, Michael. We have one more question currently, so if you do have more questions, please keep them coming in. You talked earlier about the time that it takes to actually see change based on rounding efforts. What kind of a time frame are we really looking at for that?
I wish I had a crystal ball to tell you that. You know, I think we usually talk about 90 days as being able to start to see some change there. But that, you know, still might be aggressive in some situations. We're talking about a lot of the times, if we're implementing a new program or even re-implementing rounding to be more purposeful, that's a cultural shift. And making adjustments to culture is not an easy process. And so to set expectations, I would say 6 months to a year as a general rule of thumb. I don't know if you all have any other thoughts on that.
Yeah, I mean, I think I agree with that, especially, you know, rounding with technology or something new to the staff members. It may take them, you know, a month or so to feel comfortable to, you know, get their flow with asking the questions, you know, joking with the patients, making it more friendly, feeling comfortable doing these rounds. So, you know, once that happens, then I think that's when the results are going to start to increase. But like Michael said, it's really about setting the culture, setting this as, you know, the rounding culture. This is what we're going to do. This is how we're going to do it. And move forward.
Yeah, and to add to that, just being able to coach the individual who's rounding. In fact, like going in, shadowing, and giving them some coaching afterwards, even doing some role play so that they're more comfortable when they are going in and conducting those rounds.
It's a really important point. We focused on the questions themselves, and really a lot of the times the key to success here is if you have the right question, do you have the right approach? And that's another topic for another day. But certainly having the foundation in questions is the first step.
And to that point, we did a guide last month. It's an infographic and a little guide that goes along with it, talking about some rounding best practices in terms of more behavioral items. So definitely check that out if you're interested. But I do want to piggyback on what you guys were saying about the timeline. Honestly, like if you're implementing this new procedure and these rounds, then you can expect some ramping up time, getting your staff comfortable with it and getting everybody really honed in. But then it's also going to take, what did we say, 60 to 90 days to get those HCAP results back for this example.
Yeah.
And then from there, you're going to have to kind of adjust your question set and make some changes, see what kind of results you're getting based on the round versus the scores. And then you're not going to get results back again for another 60 to 90 days. So really just thinking about that process, about honing in and really improving something, it takes time, unfortunately.
It does.
Yeah, but the good thing is, hopefully once you have the good system down, the culture in place, then it will be where you want. You can just continuously make those small improvements.
Yeah, great advice all around. All right, well, it looks like we're about 2 minutes from the end of our webinar, and we don't have any more questions. So we really appreciate you taking the time to join us today. Again, if you do have additional questions, reach out to us. We're here for you. We're happy to help you. We really want to make this a better process for you to achieve your goals. So check us out next month for our next topic, and we hope to see you all again on one of our webinars. And when you do close this window, a little survey will pop up. If you wouldn't mind just taking a minute or two and filling that out, it'll help us improve these webinars for the future and really let us know what you're looking for. So let's help customize these to you. So thank you again for joining us, and we look forward to speaking with you again later.